Hello, everyone, and welcome to Emergency Preparedness and Response podcast series. My name is Srinath Yadlapalli, a nephrology fellow at Indiana University School of Medicine in Indianapolis, and I'll be your host. The title of today's episode is The Measles Threat: What Every Nephrology Professional Needs to Know. We are discussing the resurgence of measles and what it means for the kidney community. As you might already know, measles cases are rising significantly, and measles is even more contagious than COVID. So it's vital for us to identify these patients early on to prevent spread and protect both our patients and staff. In this episode, we will cover vaccines, post-exposure prophylaxis, and management. Additionally, we will also focus on preparedness within the dialysis unit and the steps to take if you suspect a case of measles in your facility. Today, we are joined by Dr. Kristina Bryant. Dr. Bryant serves as the chair of Nephrologist Transforming Dialysis Safety Work Group, in short NTDS, which is a collaboration between the CDC and the ASN. Her work with NTDS centers on reducing preventable infections in people with kidney diseases, including those receiving maintenance dialysis and kidney transplant patients. She's also a professor of pediatrics at University of Louisville School of Medicine and serves as the hospital epidemiologist at Norton Children's Hospital. She's also the medical director for System Pediatric Epidemiology and Infectious Diseases for Norton Children's Medical Group. In addition, she's also the associate medical director at the Louisville Metro Department of Public Health and Wellness. Chris, thank you so much for joining us. To start, can you describe measles and its signs and symptoms?
Yes, measles is a very contagious viral illness. It's spread through the air when an infected person sneezes or coughs, and somebody else breathes in the respiratory droplets containing the virus. One thing to know about measles is that it remains viable in the air for up to 2 hours after an infected person leaves the area. The incubation period of measles, the time between exposure and the development of symptoms, is usually 10 to 14 days, but it can be as short as 7 days or as long as 21. Most symptoms of measles are similar to other viral illnesses, and these include fever and the three C's: cough, coryza, that's just a runny nose, and conjunctivitis. Consequently, there's a significant risk of measles being confused with other respiratory viral infections. Some patients may have tiny white spots called Koplik spots inside the mouth. These aren't always present, but when they occur, they usually appear 1 to 2 days before the skin rash. When you see these, think measles. The rash of measles is a rash that begins as flat red spots on the face, and then it spreads downward to the neck, the trunk, the legs, and the feet. Patients are contagious 4 days before the rash appears and 4 days after.
Thank you, Chris. So the initial symptoms are like any other viral infection, and patient is contagious 4 days before the rash even appears. Now, let's talk about the clinical impact. What are the complications of measles and who is at increased risk for them?
The most common complications of measles are ear infections, diarrhea, and pneumonia. In about 1 in 1,000 cases of measles, encephalitis can happen or swelling of the brain. Complications of measles encephalitis can include seizures, hearing loss, and intellectual disability. The estimated mortality of measles is 1 to 3 per 1,000 cases. The people most at risk for complications are children younger than 5 years, adults older than 20 years, immunocompromised individuals, and pregnant people. Now, Before we leave the talk about complications, one other thing that we should talk about is immune suppression or immune amnesia. After a measles infection, people become more susceptible to other viral and bacterial infections, and this susceptibility can actually be prolonged.
Thank you. Immune amnesia is scary for anyone, but particularly kidney patients are already susceptible to many infections, and having immune amnesia is scary for them.
It is, right? It means that patients are more susceptible to other infections. And that's one of the reasons that measles is something we really need to prevent.
Thank you, Chris. Given that we had a highly effective vaccine for decades, why are we seeing such a significant increase in measles in the US over the past couple of years?
Well, it's complicated. So in 2000, measles was declared eliminated in the US. And this was achieved through high immunization rates with the measles, mumps, rubella vaccine, combined with strong public health surveillance for cases. And then when cases did occur, effective containment to prevent the spread. Now, elimination doesn't mean that we had zero cases of measles, but rather we might have a case here and there, but we didn't have ongoing spread throughout a community. The recent surge in cases is likely due to decreased vaccine coverage, immunization rates are dropping, combined with increased global measles activity, and this has really created a perfect storm. Measles is one of the most infectious viral illnesses that we know about. So let's talk about the R naught and how infectious measles is. So if we take 10 people who have no measles immunity and expose them to measles, 9 of them out of the 10 will become infected. The R naught is the number of secondary infections that can arise from a single infected patient. For measles, the R naught is 12 to 18, and that's significantly higher than for some other viral illnesses. Just for reference, the R naught for the common cold or even influenza is just 2 to 3 cases.
Wow, with the R naught such high, the potential for a rapid outbreak is enormous. How can people protect themselves against measles?
Great question. Vaccination is the very best way to protect against measles. One dose of measles containing vaccine is 93% effective, and 2 doses are about 97% effective at preventing measles infection. In the United States, the first dose of measles vaccine is usually given at 12 to 15 months of age, and that's followed by a second dose at the time a kiddo enters school, so 4 to 6 years of age. One important exception to know about is that when an infant is traveling outside the United States, a dose of measles vaccine, MMR, can be given as young as 6 months of age, and that is recommended. The child will still need 2 doses of MMR at the usual ages. Adults without measles immunity should ideally receive at least 1 dose of measles vaccine, and that includes adults with chronic kidney disease. The safety of measles vaccine has been thoroughly studied, and this is a safe vaccine. There are a couple of things to know. Because this is a live attenuated vaccine, it's not recommended for pregnant or immunocompromised people. Kidney transplant candidates should be evaluated for measles immunity and vaccinated pre-transplant if possible, because we don't generally give live attenuated vaccines after transplant. Close contacts of transplant patients can and should receive measles vaccine. And this is one way that we can protect people who've had a transplant. We vaccinate everybody around them.
Thank you, Chris, for pointing out the critical timing and importance of vaccination before kidney transplantation. Now, how can someone assess their protection against measles?
All right. Well, there's a list of things that are considered presumptive evidence of immunity against measles. So, immunity to measles is assumed to be present among people who were born before 1957. That's because before 1957, everybody got exposed or infected. Um, we also presume measles immunity in people who've had age appropriate vaccination. So, for preschool age children, that's one dose. School age children should have two doses. And most adults who are not at high risk for measles exposure, need one dose of measles containing vaccine. Now, here's a caveat. People who were vaccinated between 1963 through 1967 may have received an inactivated or killed vaccine, and it turns out that one wasn't very effective. The inactivated vaccine was withdrawn in 1967, so if you had that one, probably doesn't count. We also can look at laboratory evidence of immunity as a way to show that you're protected. Essentially, this is a positive measles IgG blood test.
Thank you, Chris, for the detailed answer. So, while date of birth and vaccination records confirm protection for most people, the recent surge in cases has many concern. Is an additional dose of vaccine necessary at this time?
No, it's not. For most people who've had two doses of measles vaccine as children, they're protected for life and they don't need any additional doses.
Okay, that is very reassuring. But what if an adult received only one dose of the MMR vaccine? Do they need another dose?
For most adults, one MMR is usually sufficient. Two doses of MMR vaccine are recommended for people at high risk of measles exposure, including adults who work in healthcare. So, us, well, we need two doses of MMR vaccine. Public health experts even say that healthcare facilities should consider vaccinating healthcare workers who were born before 1957 unless you know that they are immune to measles. So they've had a measles IgG test. Other adults who need two doses of vaccine include anybody who's traveling internationally, students at post high school educational institutions, and then family members and other close contacts of immunocompromised patients. All of these individuals need two doses of MMR vaccine. An extra dose of vaccine may also be warranted for individuals in an outbreak setting or when there's a high rate of measles transmission in the community. If this is occurring, public health authorities will make a recommendation that adults who've only had one dose need an additional dose.
Okay, got it. Thank you, Chris. Before we finish discussing the vaccines, can you talk about the safety and adverse effects associated with them?
Yes, this is a common question. So, the safety of MMR vaccine has been thoroughly studied, and this is a very safe vaccine. The more common symptoms we see after vaccination include a sore arm at the site where the injection was given, fever, and pain. A rash can occur in about 5% of people. Now, some people will temporarily develop sore or stiff joints after vaccination, and this is associated with the rubella component of the MMR vaccine. It's more common in adults than children and more common in women than men. What's not associated with MMR vaccine is autism. This has been evaluated in multiple studies, and there is no evidence that MMR vaccine causes autism.
Thank you, Chris, for clarifying those details and specifics, especially regarding autism, as providers often get asked those questions by patients because there is so much misinformation out there. If a patient does contract the virus, however, how do you treat measles?
Well, there is no specific antiviral therapy for measles. Management consists mostly of supportive care to relieve the symptoms. Although vitamin A supplementation has been shown to reduce measles mortality in malnourished children, it's not a replacement for vaccines, and it doesn't do anything to prevent the disease. Given the current measles outbreak in the US, the Centers for Disease Control and Prevention have updated guidance to include vitamin A administration for children as part of supportive management. An important thing to know is that vitamin A should only be given under the care of a healthcare provider. For adults in the US, vitamin A supplementation is generally not recommended. And it's also important to realize that overdoses of vitamin A can be toxic.
Thank you, Chris. I actually read a few news articles on vitamin A intoxication during the West Texas outbreak. Uh, Moving on to the next question, since treatment of measles is mostly supportive, prevention is the key. However, in cases where exposure has already happened, is there a role for post-exposure prophylaxis?
Yes, maybe, depending on the situation. So, for vaccinated individuals or those who have presumptive immunity, there's no need for post exposure prophylaxis. They just need to be aware of signs and symptoms of measles and watch for signs and symptoms. For individuals who are unvaccinated, they can receive the vaccine within 72 hours of exposure and still be protected. For individuals who can't receive the vaccine because of age, immunocompromise, or pregnancy, the administration of immune globulin for post exposure prophylaxis is recommended, and this needs to be given within 4 to 6 days after exposure. Vaccine and immune globulin shouldn't be administered at the same time because the immune globulin can make the vaccine ineffective.
Thank you, Chris. It's reassuring to know that you can give the vaccine within 72 hours of exposure and still protect our patients. Now, shifting from individual patient to a facility as a whole, how can dialysis centers be prepared in setting of increasing measles cases?
Yes, with all of the measles cases in the US right now, it is important for every healthcare facility to be prepared, including dialysis facilities. So here are some tips. Ensure that all healthcare personnel have presumptive evidence of immunity to measles, and this can be through vaccination records, laboratory evidence of measles immunity or prior disease. That's a positive measles IgG blood test, or birth before 1957. Remember, healthcare facilities can still choose to check immunity in people born before 1957 or recommend immunization. Number two, ensure that all eligible patients have been immunized. Remember that there are some contraindications to measles vaccine, and these include severe allergic reaction to a vaccine component following a prior dose, severe immunocompromise, systemic high dose corticosteroid therapy for 14 or more days, and pregnancy. We don't give live attenuated vaccines to pregnant people. Also, in general, live attenuated vaccines like MMR should be avoided in patients taking immunosuppressants like rituximab, and patients might be taking that for vasculitis. All facilities should be prepared to recognize the signs and symptoms of measles and have a plan for how to respond if measles is suspected in a patient or a visitor. Steps include prompt isolation, communication with the medical director, the patient's nephrologist, and public health authorities so that testing can be arranged and contact tracing can be initiated if necessary. Now, if someone presents with symptoms concerning for measles, it may be necessary to transfer that patient from the dialysis facility to another facility that is better equipped to care for a patient with measles. If a patient is transferred, the receiving facility, the staff there, the transport providers, all need to be informed of the suspicion for measles and the need for airborne precautions. If you suspect measles in a patient at a dialysis facility, provide them with a face mask. This is a surgical mask or a procedural mask, and immediately try to isolate them. Now, ideally, they should be placed in an airborne infection isolation room if one is available, and then transferred to another facility as quickly as feasible. If you don't have an airborne infection isolation room, place the patient in a private room and close the door. Pending transfer, the patient should wear the procedural or surgical mask. And then after a patient is transported out or leaves the facility, remember to keep the door to that room closed for 2 hours because measles will hang in the air and be infectious for up to 2 hours after the patient leaves the space. Now, one good thing is that standard cleaning and disinfection procedures are adequate for measles. No special cleaning is needed.
Thank you, Chris, for sharing your expertise today. Healthcare settings and especially dialysis units are high-risk environment due to the congregate nature in which they operate. Just before our interview, I checked the Johns Hopkins tracker, and in 2025, there were 2,213 cases of measles in the US. Now, just 3 months into 2026, we have 1,194 cases already. With these rising numbers, there's a significant chance you may encounter a measles patient at your facility, and we hope this knowledge helps you prepare. Thank you, everyone.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or another qualified healthcare professional. If you have any questions about any medical conditions or before or taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast by the American Society of Nephrology.